and so, but this presentation is focalized in clinical cosmetic application with cannabidiol, because in this year I tested many application of cannabidiol, and I try to explain with between us if it is possible to use a cannabidiol in a topic application in different way. Cannabidiol in cosmetics, do you remember for us it is possible to find cannabidiol in Cosing in a search or search of cosmetic trade name, okay? In Inky, do you know the Inky? Okay, the Inky is the name of in cosmetics, and in Inky, if it is possible to find cannabidiol as from extract or for synthetic produce. In the last in this last period, I remember that there was a restriction. Now it's deleted. With the use of cannabidiol, now it's possible to use cannabidiol without restriction. Which are the application for the cannabidiol? The application, the function in cosmetics, the correct name is the function. The function are anti-sebum. Anti-sebum is a principal activity of cannabidiol. The other application is antioxidant, skin conditioning, and skin protecting. But these functions are general function. In fact, it is possible during the presentation we can find different application and different way to use of this molecule. Wow. Okay. The source of cannabidiol is different, as you can see. Is synthetic, and but for synthetic is important the assay, because I used the pure synthetic cannabidiol. I try to use in parallel synthetic and natural. And for natural is important the assay and the impurities. Impurities as impurities understand or unknown or known. It is possible to define the different application in base of elemental impurities. For my application, I decided to use the synthetic application. Why? Because in cosmetics, especially in Switzerland and in Europe, the classification and the mode of application for the activity in cosmetics is not very clear. And so I, in different for different countries, for example, in Holland or remember in the UK, it was possible to use, for example, natural or synthetic. But in other parts of UA, it's not possible to use for the same in the same time. And in order to avoid any problem with any legal problem, I decided to use the synthetic. I tested in parallel natural and synthetic. How to test in cosmetics? I tested the first step is the safety. The safety is EOCD is a guideline for in order to define the safety for the raw material, and in this way I tested in irritation test, and the vitality was very good. Another test was eye irritation, and in this case there was no irritation, and I tried to use for different concentration in cosmetic formulation. In general, the concentration in cosmetics is not the same, for example, for the oral ingestion. For example, for oil, it's totally different, because in oral it's possible to increase the percentage of the product, for example, 5, 10, 20%. In cosmetics, it's not possible, because the cannabidiol is a lipophilic raw material. It's very difficult to soluble inside of the formulation. In order to maintain the stability for a long time, for example, my formulation are stable for 3 years, and after, I decided to use, for example, in general, from 0.0 gram per kilogram to maximum 1 or 2%, okay? Because after this concentration, the activity remain in plateau, and if I want to increase the quantity of the cannabidiol, but in parallel, the efficacy is not growing up. The cannabidiol in cosmetics is, for example, for sebum regulation is the principal activity. Now we can find for moisturizing, for lenitive. Lenitive is a very common activity in cosmetics, and anti-aging. Now is anti-aging. So I know that there are a lot of raw material from cannabidiol, but it's very difficult. It's very important to define the difference between cannabidiol and hemp seed oil. It's totally different. Another application, another situation, and the efficacy is totally different. My company is Crystal Hemp. We are located in Lugano, in Switzerland, and I formulated this line that contain cannabidiol, and I'm selling in Italy and in Switzerland. In Italy, Italy belongs to Europe, and but in Switzerland, the regulatory aspect is the same of UA. Is the same of the UA. It's important to use the right words in order to avoid, for example, medicinal or therapeutic properties. In this way, it's not possible for cosmetics, because we are in pharma, or in some cases, medical device. Which is my interest? My interest is in a part of a disease, atopic disease, because my expertise is very important in atopic application, and I decided to treat the atopic dermatitis. Atopic dermatitis is a very common disease, especially with chronic relapsing and remitting inflammatory of skin disease. It's very common, and common especially for the children in a very first period, from 1 to 3 years. Okay, but during our life, in general, the percentage of the atopic dermatitis is decreased. The general situation, the etiology is about of, in general, in parallel with asthma and allergic rhinitis, but the general aspect, because I am a clinical, the general aspect is a dry skin lesion, eczematosus lesion, skin infection. It's very important because in parallel I noticed that the quantity, the percentage of Staphylococcus aureus was very, very high, and the IgE is very high. In general, the problem is in parallel. We can find, for example, the stress, general stress, or skin stress. In the children, the lesion were more pronounced than in adults, especially from 1-2 years for age, and during the adolescence and the adults change the situation, but remain in a position very, very high. So which are the cycle of the atopic dermatitis? The most problem is the alteration of cutaneous barrier. After this is a bacterial colonization. After the bacterial colonization, there is inflammation. Itching is a very big problem in atopic dermatitis. And the scratching. After the scratching, it is a cycle restart, and it's a very, very big problem, especially for the baby. In this case, it's very important to define the dysbiosis. In fact, in the last year, there are a lot of scientific literature about this situation. Not only in atopic dermatitis, but also, for example, in psoriasis and in acne. In fact, there are a lot of publications about in PubMed about the use of cannabidiol in this disease. The microbiome is important because is directed, collected with the nervous system. Okay, in this way we can promote the right balance on the skin, and it is possible to maintain the right balance with the microbiota, and in this way we can maintain the hydrophilic film, stratum corneum in the right way, and it's very important the intercorneocytar cement, because remember that the barrier is important to maintain the right concentration of the water inside of the skin, and to protect our skin for the external activity.
Sorry.
Okay. Microbiome is very, very important. Another aspect of the microbiome, remember that the microbiome is not viable microorganism and are beneficial for host health. Microbiome is important for the activity to maintain the right balance in our skin, and to maintain the crosstalk with all cells. In this case, for atopic dermatitis, we are talking for epidermidis, aureus, acne, and xerosis. The endocannabidiol system is important because it is a network for molecular signal and to contribute to the body homeostasis. I go very, very fast because the time is very short, okay? endocannabinoid system for the skin is important for the CB1 and CB2, especially for the CB2, but is in general in our skin there are all together, both. In the antimicrobial is important to maintain the antibiofilm in our skin, and is important to maintain the right homeostasis in the skin. I go very fast. Okay, which is my study? I study CBD alone or CBD in a combination. I tried two alone, but the results were very good, but not very efficient. I tested in the combination with microbiota and some raw material, for example, cholesterol and other, for example, ceramides. And in this case, the results were very good. In fact, I tested in a randomized double-blind placebo and controlled clinical study for 40 patients, and now I show the results after 28 days of treatment. The SCORAD is the typical key indicator for the atopic dermatitis. After 28 days of treatment, reduce of to around 30% of the SCORAD score. For the POEM is a typical patient-oriented eczema measure. Is a self-assessment in order to evaluate the atopic dermatitis severity. And in this case, I observed the reduce of around 52% of POEM score. It's very important. The itching after 28 reduce 33% of the value. It's very in this case, I registered this product in medical device, not in cosmetics. Okay, I have 3 products. One cleansing product in order to maintain the barrier. The second product is a medical device, and the third product after the switch, when the itching is finished, switched in cosmetics, and it's possible to maintain the cosmetics for a long period. The itching test showed minus 33% of the value. The transepidermal water loss is very important because in this way I demonstrated the activity of the barrier cream, and the transepidermal water loss showed minus 20%. The moisturizing plus, because it's normal, it's not reduced, but it's plus 20, around 30% of moisturizing. In conclusion, the cannabidiol in combination with the other raw material is possible to demonstrate the toxicological safe. It's very safe, no risk for the skin, but it's very useful in cosmetic treatment as a lenitive, anti-aging, moisturizing, or anti-sebum, but in particular has proven efficacy in supporting of the treatment of atopic dermatitis in combination with ceramide, cholesterol, and microbiota active ingredients. In this way, it's possible to demonstrate that in combination are better than alone. Okay? Thank you. Sorry.